Good morning, good afternoon, good evening, and welcome back, everyone, to another Tackling Taboos podcast brought to you by the Open Reach Ethnic Diversity Network, the EDN. I'm your host, Stephen Adubafor, and I'm a project manager in the Exchange Exit program, but also the events lead for the Open Reach EDN as well. And I bring to you today another set of amazing guests who are here to talk about the subject of healthcare within the Black community as part of our Black History Month series of podcasts that we've been doing. Firstly, thank you everyone who's tuned into the first couple that we've done so far, and then we've had some really amazing feedback. So if you haven't already checked them out, then yeah, there would be in some of the links that you've been sent previously in the prior days. But yeah, we're really looking forward to getting into this one because there's a lot. Like we're just talking off camera, and there's a lot of topics that we can dive into. But we will try and time box this one to probably about half an hour. But if there's cause for a part two, then pop something into the comments and we might do another discussion. But I will dim down my mic and introduce some of the amazing guests who we have with us this afternoon. So I'll start with Elang. Welcome.
Thank you. Afternoon, everyone. My name is Elang Manang, and I am based in Liverpool. I'm currently working in Deo. I'm on the graduate scheme doing a junior data science rotation, and I am originally from Botswana. It's a country next to South Africa, so in the southern part of Africa. Born and raised there, and I moved to the UK when I was 19 on my own for university, and I've just stayed since. So yeah.
The land of the diamonds. Am I correct?
Yes.
Yes. Wow. Well, welcome to the podcast, Elang. Great to have you on. Yemi, welcome and hello.
Hi, my name is Yemi Adelekon, and I work in OpenReach, HR within OpenReach, and excited to be here, originally from Nigeria. So yeah.
Welcome, amazing. It's good to have you on. And Asima, last but not least.
Hi everyone, my name is Asima Habter, and in terms of my day job, I'm a culture manager, so it fits in transformation and change. And I've been in OpenReach for 5 years, based in our London office. Um, I'm originally from Eritrea in East Africa.
Amazing, and welcome Asima, and welcome everyone again. We'll dive straight into some of the topics because we've got a lot to get through. So healthcare, and the reason why we're talking about this specifically from the Black community point of view is something that like maybe outwardly like doesn't always seem like there's a bit of a difference, but I think when you really dive into the numbers and the statistics and actually listen to people's experiences, there are many cases of like inequality that exists within the healthcare space, even like within the UK, looking specifically. So we know that there's, for example, stereotypes that exist within the community surrounding Black people and how they're treated by like maybe doctors and nurses. And again, a lot of this might be done in a like kind of covert way, not necessarily overt, but it does have the effect later. So I don't know, maybe Asima, if you wanted to kick us off with some of your thoughts on some of the stereotypes that you think you've either experienced yourself or definitely know exist.
Yeah, so I guess like as you mentioned, like when you look at some of the stats and the data, there's definitely an issue. Or the data is showing us there's definitely an issue when it comes to someone's healthcare experience from a Black community. The one that kind of like jumps at me is around Black women being like 3 to 4 times more likely to die from pregnancy or pregnancy related complications. Um, so, I mean, we know that for generations people have been having children. This is not anything new from a healthcare point of view, but the data does show us that there's a disparity when it comes to Black women's experience. Um, and like for me, that's quite scary being a Black woman myself living in the UK. Um, and I mean, we probably need to dig a bit deeper to understand like why that's happening. But I think we also do know that just generally, like there are inequalities in society, and people from a marginalized community, i.e., Black people, end up being the ones that suffer the most. Um, but I mean, we could talk about this one for ages, but there's loads of other stats as well that do jump out. But for me, it's more around like if you look back at history, and you look at the experience of Black people in healthcare, there has been lots of, I say, bad practices. a lot of testing that was done on Black people to kind of test new ways of like healthcare procedures. So I'm not sure whether that kind of stems to like the whole idea of Black women having a higher pain threshold, because there have been lots of kind of let's say trials being performed on Black people in history. Um, but I think for me, it's around the not identifying issues early enough that then creates other bigger problems, i.e., death, for example. So that for me is something that's quite worrying, being a Black female in the UK.
Mm. Oh, yeah, I mean, do you want to go just to build on
Yeah,
that?
I was just going to build on what Asima said there. And I think, I mean, if you look at the stats around breast cancer, so Black women have a higher mortality rate from breast cancer, even though breast cancer treatment has really advanced. My husband is a breast surgeon and a breast consultant and oncoplastic surgeon. And I know the prognosis that many of the patients get. So it's sad to know that more Black people would die from the same condition that the average white person would not even think of death happening. Um, can't confidently say that all of that is the fault of the NHS or it is the fault of the system. Some of it could just be our own communities as well, maybe being reluctant to go for their checkups, and to, if they identify a lump, are they likely, is our community, are there people that are likely to use faith-based beliefs to try and pretend it's not happening? Are we likely to go into denial about what's going on, about the realities of what's going on? And I think some of those fundamentals are things that our community needs to address. Number one, that acknowledging that there's a condition or there might be a condition isn't that you're declaring it over yourself. It's not like you're pulling it into your life. And then going into the hospital as early as possible, as well as asking the right questions, because again, the average white person, because my husband will tell me all the time, they ask about the treatment options, they challenge him on what he's telling them, they ask for a second opinion, they tell him to his face, do you mind if we ask somebody else? And he says, of course not, you can. But then how many of our community would feel that level of confidence to not just take what a surgeon or a consultant tells them, but feels that they have a right to ask about other options rather than just take the first option that is given to them. So I think there's that education and awareness within our community that needs to happen, that says that when you go in there, you don't go in there as a Black person. You go in there to access the same healthcare as a human being. And so have that confidence and have that expectation of the best quality care. And if you don't believe you're getting it, then speak up on time.
And I would also like add to that as well, around, our communities, because I know that, especially, I don't know if everyone's can relate to this, but in my community, there is a stigma attached if you do have a condition, a healthcare condition, and people don't openly share what they're going through. And the reason why I think um, that is important for us is because there's a lot of learnings that we can do from just speaking to our community, and like you said, the education can come from within the community as well. But when if somebody, like, God forbid, is going through something like that, there's generally a stigma to even like publicly share that, which then means that people are usually suffering in silence when they could have actually maybe sought some advice from the community. But then for other people, if they are going through something, that could lead to like early preventions as well, or taking early preventive measures, had they had that education or knowledge in the first place. So I definitely do agree. There's like there could be systemic stuff, but there's also stuff within the community as well that we could be doing better at as well.
And I think if we kind of link that to some of the maybe lack of family history, that some, because again, building on what Asima you just said there, the fact that we don't talk about it means that we're not willing to go ask our parents or about a health condition, because then we don't want to worry them, and and that could then lead to people not getting the benefit of family history and bringing it forward to talk about it. Because when you feel like a shame or a stigma attached to something, then you don't explore it and you don't discuss it with anybody. So it's not just that we don't help each other by having support systems, we don't normalize those conditions as part of human reality. And then we don't actually get to warn any of our family members who could maybe have done something earlier because something has been caught for somebody else. Elan, do you want to jump in here?
Just to add on to what you've been discussing, I definitely think we do have a tendency to suffer in silence, especially in the Black community. So just coming together and kind of sharing with one another the problems that we might be facing, whether it's like physical problems, mental health problems, could really set us up for success. And I think also get the confidence to also trust in the healthcare professionals that will be seeking this advice from, because I also think a lot of Black people, when they kind of walk into a hospital, there's already that at the back of your mind, you think I will be treated differently because I am a person of color, but kind of leaning on our communities to get that strength could really take us far and help us kind of solve a lot of issues before they become really big healthcare issues.
Yeah, I think on that point as well, I see it as kind of two sides in terms of like walking into hospital and maybe having an assumption of being treated differently versus like the reality. I think the positive side is like there's more of our people getting into the healthcare system, especially at the higher levels, and actually can have the influence that we need. Like your husband being a perfect example, being a consultant in that field, so then actually he can have that level of expertise. But I do think there is still like inherently a bias, like away from our community and maybe like towards especially like the white community in terms of the way the textbooks are set up and the way like doctors are actually taught to practice, like isn't necessarily done on an equal measure. So and there are biological differences between like Black people, white people, Asian people. So actually like it can't be a blanket rule like for everyone. And I don't think from what I've experienced and I've got family members who are like in the healthcare system that there isn't that like level of detail to help there be equity rather than like actually like equality within the healthcare system. But I don't know if you guys have had similar experiences or heard certain similar things.
I think ran across a video on TikTok, and I love the fact that a lot of Black healthcare professionals are coming up, because a lot of skin conditions that people learn is on like the pictures that they display as white skin or like lighter skin, if that makes sense. And a lot of healthcare professionals that are coming up now that are Black people, people of color, have started to kind of go into what do these skin conditions look like on people with darker skin, with more melanin. So I love that we're starting to kind of get that representation, and I do think it'll kind of pave a way for better healthcare treatment in terms of skin conditions for Black people.
That's really, I think that's really powerful. I haven't seen that on TikTok, but I know of a guy that's now building prosthetics that are the same skincare color for the people of color. And then there's another guy that's like updating medical books again with that same mindset to make sure that the pictures that are there when it touches on skin color, because then when they say something like put a glass cup on it to know whether it's measles, it would appear that way for that color of skin, but what would it look like for us, and what is that picture that we compare it to? So I definitely think there's that thing still there. One that really stands out for me is like sickle cell, and that what you said, Stephen, around the treatment that people get could still be there's still some level of bias in there. And so I've been in hospital with patients with sickle cell, and the perception is that because you're Black, you're likely asking for the morphine, because you like the drugs and da 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 da, and that can mean that they leave you in pain a lot longer than is necessary. And then in some instances, you find that somebody in the hospital with a condition like they got drunk and they are acting or they are high on drug, they get more attention than a Black person who is there screaming with the same level of pain or even a lot more pain, but then the attention is given to this person whose condition is alcoholism and something that maybe they've just gone to on a bender and they've hit their head or something. And when I've been in hospital with patients like that, sometimes you feel like you're fighting for your person to help the doctors to understand they are not exaggerating the pain, because they come in, have this casual look, and sometimes the perception is almost like it can't be as bad as you think. And it's like, is that a perception? And should you make that kind of judgment? And would you make that judgment if this person looks a bit like you? And I think that is definitely one of those fields where I feel like them expecting us to have a higher pain threshold, or expecting that we might be putting on an act, especially if it's boys, even more than girls. If it's boys, then that stereotype kind of heightens again, like, oh, who knows whether he's a druggie, and that's why these other ones are not working. Maybe that's why he's asking for morphine, and for all they know, that person might have never taken anything in his entire life, and is just responding or acting or asking out of the pain that they are in.
Does that pain threshold play a part in some of the other inequalities, so like maybe breast cancer or pregnancy, or do you think the two are not really linked? The perception of higher pain threshold.
I do think there is. I think there is a link in terms of um from speaking to like even like my other Black friends, and even from my experience, um, it's like when you do go to speak to your GP, if you've got an issue, there's it can easily be brushed off, as if like it's not a problem yet. Like you need to suffer a bit more. And I don't know if that is linked to the like general, like we've got shortage of resources in NHS, or if that's also embedding the biases that like Black women or Black people can endure more pain anyway. So had another person from a white background said the same thing as me, where they had the same experience, that's the bit where it's then it would be more about race. And I do know that certain medicines as well, and like the testing that's been done in the past from the trials, it might not cover a wide demographic of races. So me taking that medication versus a white person may have a different impact. And I think once we have that kind of, I guess it's always going to be hard for us to influence that. But I do think there's a lot of onerous on Black people to have to fight harder to get a solution when it comes to healthcare situations, because you can get brushed off in that whole system, which then can lead to like other problems in the future. So I do think there is a link.
No, well said. And I think even on that aspect of pain, and like we touched on a couple of podcasts ago about like the strong Black women narrative, and I think like there's a lot to be even delved deeper into in terms of how that narrative affects like Black people within healthcare. And I know Elang, you had a couple of points like kind of related to that narrative as well. So
Yeah, I think that narrative definitely affects Black women when it comes to mental health as well. Like Black women are less likely to speak up when they're suffering from things like depression, anxiety, less likely to seek help as well, because I think we're just expected to be strong. And it's also kind of like when we do go out and kind of seek that help, what reception do we get? Like, are we kind of guided through it, or are we just kind of brushed off and told, okay, come back when it's a bit worse? But what could a bit worse look like, Yeah.
I think in our community, something that also lends to that, in terms of delaying people going forward initially, is the fact that a lot rests on the Black woman. In a lot of our communities, there's a lot of reliance. Some of the parenting, or a lot of the parenting, can sometimes fall on the women, and so there's that whole perception of I can't afford to be ill, and so you're the last person. I mean, you put yourself last when you're thinking of everybody else, and you're holding the family together. And I think that could be contributory, so that by the time they are going to access healthcare, things are a lot worse. And yet the healthcare might have systems, so they might have like, oh, you first get assessed by this, and then you get assessed by this, but not forgetting that this person is coming when the assessment level should be here, not putting them at the bottom of, say, first have a conversation with this level person. So I think all of that needs to be brought together. And the other statistics that kind of, when it comes to mental health, another statistic that kind of struck me was that despite having a higher prevalence of mental health issues, we have the lowest treatment of any ethnic group in the UK. Even though there's a higher prevalence of mental health issues amongst the Black community, we have the lowest treatment of any ethnic group. And 6% of our community, compared to 13% in white British group, based on the care that they would, the treatment that they would get. And then is there, again, one thing to bear in mind is there a stereotype that if you're Black and have mental health, it's your fault? So you must have been a druggie. You must have been, do you know what I mean? But if you're a different color, it could be, oh yeah, there was just so much stress. And then the words are stress,
society,
anxiety, disorder, bipolar. You get all of these nice narratives, but when you're Black, the first thought is, did you do drugs? Did you do drugs? And do you know what I mean? Almost like, oh, it must be the drugs that's triggering it. So it's self-brought. And if it's self-brought, then why is it a priority? Do you know what I mean? But when it's positioned as, oh, it's bipolar, oh, it's anxiety, it's ADHD, then it's not your fault. It's just happening to you. And I think that whole narrative could be playing, I'm not sure, but I feel like it could be playing into that, because that's one of the first questions you would get if you're a Black male with mental health issue, is the assumption of, do you smoke, do you do drugs, do you do this and that? Whereas for somebody else, it could be questions like, what else is going on in your life? What does your support system look like? So there's that perception of it's anxiety, it's stress, rather than it could be drugs, and it could be for any color.
Yeah, and I think for my own personal experience, we definitely see less empathy towards Black people, especially when it comes to mental health. Because when I moved to the UK, a friend that I was really close to as well really struggled with her mental health for a long time, tried to seek help, kind of didn't really get that help, eventually got misdiagnosed, put on the wrong treatment, and unfortunately led to her taking her own life. So it's things like that that kind of make you think, is it because if it's someone else, treatment's given quicker, I think more care is given to that person. But if it's a person of color, they don't really have that.
And
go on, Zima, yeah.
I was just going to add, like, on the mental health side, because obviously when we talk about healthcare, there's obviously it is often overlooked around mental health generally in the Black community. Like, it's kind of a stigma attached just generally to mental health in itself and seeking help. But I think when we look at kind of like if you were going to go like with if people suffering from mental health issues, there is a lack of like Black representation in those professions as well. And I think that is also like a disadvantage for us, because there's so many kind of cultural complexities that exist in our communities, and having someone that kind of looks like you when you're going through some sort of treatment, it can shape what kind of service you get, what kind of treatment you get, and I do think that having the representation in those professions is as important for us as well in our communities, and because if you have someone that does represent who you are and your culture, and it might not be exactly the same background, but having that kind of representation in those professions, I think is really important for us as a community, and something that we should be trying to promote from within as well to get to those positions.
And I think sometimes, to build on that, Asima, it's also the fact that there are times when there's representation, but it's only in pockets of the area. So like when it comes to sickle cell, if you live in the Northwest, then you have to go to Manchester to be able to get decent care for sickle cell. You have to be in Birmingham, you have to be in London, because those are like the really Black, heavily populated. And if you happen to live in Yorkshire or somewhere else like that, then the doctors are like, I don't want to use the word clueless, but they don't understand the intricacies, the latest treatments, and so there's that reliance. So I think from within our communities, it's not just a willingness to go into certain fields; it's a willingness to also work in different parts of the country and to recognize that our people are scattered all over, and what kind of support can we have for a lot of those communities.
And if you look at, and I'm glad we had the discussion around mental health, because this month was World Mental Health Day on the 10th of October. And I think that being intertwined with Black History Month was a poignant time to be able to reflect. And I think even kind of looking deeper as to the reason why some of these issues would happen within the Black community, and maybe some of the diagnosis and treatments wouldn't be as we would want it to be, would be actually the financial statistics. And I know, Simi, you found a stat earlier, which I'll let you read out, and this might need a whole podcast itself. I wanted to make the point that if like Black people are the kind of cultural representation or minority who are struggling the most financially, then actually is probably one of the biggest underlying reasons as to why a lot would suffer from mental health issues, because you're constantly, living from paycheck to paycheck, or not knowing where your next meal is going to come from, or like, yeah, trying to keep up with house, kids, job, everything, as well as then even some of the, as you said, cultural complexities and the deeper social issues that we might have to face. But even as a foundation level, like a lot of, our community don't even have that like solid base foundation to then be able to build the rest of their life from. So then why wouldn't that cause you stress on a regular basis?
Yeah, absolutely. Because when you look at those stats, especially they were quite they were quite stark during COVID, where disproportionately Black people in healthcare died a lot more than their white counterparts. And when the study was done, looking into some of the reasons behind that, some of it was because one, they were less likely to maybe complain about some of the protective gaps that they had. So there were some places where there weren't enough. And so the Black person was more likely to still maybe take a risk to go treat somebody whilst not having got something that they needed. And then there was also this, I don't want to use the word social mobility, but there was also that background side to it. Like maybe most of them would live in certain communities where the environment isn't the best. And so their own health going into that pandemic is also not at its optimum. And then when they go back home, maybe they're going back into an overpopulated space, a shared space where there's a higher risk because maybe it's multiple families, when I say families, maybe multiple people like sharing, and all of those. And then what they could afford to eat as well. So when they did the study, they found that there were so many other factors, that underlying factors that could be affecting their own health as a baseline. And then you take a body that isn't at optimum health peak of health, you take that into a situation of a pandemic, and then that just becomes like a ticking time bomb. And it's no wonder that disproportionately a lot of Black people in healthcare died more than their white counterparts. And then Black people sometimes, as you said, whether it's a function of wanting more money or trying to go from paycheck to paycheck, they are more likely to take extra shifts because of that extra money. But then that means a lot less sleep, and all of which starts to affect their bodies while they continue going.
Yeah, essentially they were already vulnerable and entering into a vulnerable situation. But I think generally, like the overall, if you talk about like um, the pay disparity, like we know as well that there is, when it comes to ethnicity and especially like Black colleagues, there is the pay gap disparity there that already exists. And that then does determine essentially your kind of spending habits, food habits, like your living habits. If you're living in the city, then there's just general pollution. That all adds to your kind of quality of life. So I definitely do think, like, whilst we're talking about healthcare, there are kind of systemic kind of factors that play a part into kind of determining like your overall experience as a Black person in society.
Yeah. And one of that thing that I think when we talk of Black healthcare and the Black community, we have to call out some of the risk factors for us as a community. So when you talk about high blood pressure, diabetes, prostate cancer, sickle cell, cardiovascular health, those are things that our communities are really, really prone to. A lot of them are lifestyle diseases as well.
Yeah.
And so we just need to, in anything that we do as a community, and then even like looking at the stroke factor, so the risk factors of having a stroke. So as a community, those are things that we need to proactively look at it, make sure that we're keeping on track with all of those measures, doing our annual checkups. And then even if somebody doesn't, if your GP doesn't ask you to come in for your review, ask for one anyway. You should ask for one and just say, I'd like to come in to check my blood pressure. For me, I found that I had high blood pressure about 14, 15 years ago when I was just going for a routine surgery. But if I wasn't going for that routine surgery, chances are I would never have known. And similar stories, other people have found out about diabetes when they went for something completely different. But as a community, I think it's something that we need to maybe take steps proactively to start to do something. Because the help is there within the NHS, the information is there, but we need to, as a community, start tapping into it.
Mm.
No, well said. Oh, Alan, do you have a follow-up?
Yeah, I was definitely going to say we need to kind of get into the habit of like advocating more for ourselves and advocating for others. And I
Mm.
think this is also where our allies come in as well, kind of giving
Mm,
your coworkers, or if you've got like line managers, giving your colleagues the support to kind of advocate for themselves and that push. Yeah.
no, well said. And just one of the final points I wanted to touch on was Black children in care as well. Yemi, I know you had a point regarding that, maybe some stats.
Yeah, I guess with children in care, I think it's about the same thing. It's similar for me to things like healthcare. So a lot of children in care, their mental health is going to be impacted just because they are in a care system. They are in a system where the reason they're there is because somebody has decided that maybe they're not acting in the right way, or they have perceptions of that they are not wanted, not loved, and that's the reason they've ended up in that care system, or they're not well behaved. And so for me, it kind of dovetails into that mental health thing, that if children in care misbehave, are they going to get the same level of support from a health point of view to say, actually, we understand the mitigating factors, or are they just going to be um, kind of brush stroked as oh yeah, these people are just misbehaving and that's why this is happening, and that's the
Yeah.
reason they're in care in the first instance? Could it be that because they're in care, and what led them to being in care, could that be impacting their mental health, and does that then give them a priority? So for me, those are some of those things that are really important for our communities to bear in mind. One is, what can we do to reduce the number of our children ending up in the care system? So whether it's like the parents not being careless with their children, whether it's that your upbringing from Africa, you realize it doesn't wash in this new community that you are. And because I know of a scenario where a child was taken from somebody because the mother just kept a really filthy house, which they felt was unhealthy for the child. And it's a community. Do you defend the mother or do you defend the child? Because do you know what I mean? And so
Mm.
things that we probably might not think is important could be something that matters to the social care system. So I think we can also educate ourselves as to how can we prevent this from happening in the first instance, and then when our children are in the care system, how can we stay connected to make sure that they are accessing the right level of care, because a lot of them will be accessing mental health care at the very least, and then
Mm.
they would need to access general health care when they fall ill. They would need to access educational care within the care system. And so even when a child is taken into care, our community needs to be aware of that child and not just
Mm.
say, well, they're in the social services now, then we
Yeah.
can just focus on the rest of the children.
Mm.
Yeah.
Mm. And
Yeah.
that's really important, especially just your childhood. That does determine how you integrate into society after.
Mm.
It determines, you know, your job opportunities, your educational opportunities, and just generally like how you integrate in society. Um,
Mm.
and I know there is like some stats around Black people's mental health issues are more likely to be arrested than their
Yeah.
white peers as well.
Mm.
And this is the thing, like if you're not getting the right help as early as possible, that then can kind of develop into kind of worse things later on in life. So I think definitely like the mental health support as early as possible is so important, especially for children in care or just generally all children as well.
Yeah.
No, well said. Thank you, everyone. We are running short on time, so we are going to start to bring the podcast to a close. But thank you, like, firstly, you three for like sharing like so many of your like experiences and raising so many like really key issues. One of the points that we wanted to always try and round like these particular podcasts off is like with the theme being reclaiming the narrative, or reclaiming narratives, and kind of looking forward and knowing that we're in a journey and we're in a place where we always want to keep improving and taking things forward. Then how can we reclaim the narrative in this healthcare space to do with our community as well? So Elang, I'll hand you the mic first in terms of like from your personal point of view, what maybe key thing you think you'd like to see society do or to take forward to reclaim the narrative?
I think a key thing that I'd like to see in society is just kind of seeing more Black people with a voice, like in those spaces, like more people kind of speaking on sickle cell, more people speaking on how it's okay to kind of seek medical help. Like, even if you feel like you have a pain, you can't just pray it away. You have to kind of go into the GP, kind of investigate what that is. So yeah, just seeing people have like a bit more courage, and also having like the support from our communities and our allies to give us the courage to kind of speak up and ask for help. Yeah.
Yeah. No, well said. Thank you. Yemi?
Mine would be that we need to normalize being sick. Being sick is it's a part of life. We have a body that is beautiful, but at the same time can fail. And so if it does fail, there's nothing shameful about it. There's nothing shameful about testing positive for something or finding a lump. And so don't hide it. Get out. Get the help. Most diseases, um, what's the word I'm looking for? Most diseases are not fatal if caught early enough. Even cancer, as dreaded as cancer is, the best thing for cancer is early diagnosis. So get checked out, and stop looking at sickness as a bad thing.
No, well said. Thank you. Basima?
So I completely agree with what both of you said. I would say for me it's about as well, kind of celebrating the role of our Black kind of people today and in the past that have kind of contributed to the whole healthcare system, like the NHS, going, even if you look at like the Windrush generation, a lot of them came over, and are like came in as nurses, healthcare professionals. Like my auntie is a carer. So a lot of these jobs today that are holding the healthcare professions today are done by our our community. So I would like to kind of celebrate that, and also kind of promote more of that going forward, and as much education between us as well, and kind of being a support system for when people that are going through those situations. So we can all be allies as well within our communities as well.
No, I can agree more with that last point. Like, I think I'd be incredibly shocked if anyone listening to this podcast didn't know a Black person in the healthcare system. Like myself, like my mom's a pharmacist, my grandma was a nurse. I've got a whole line of cousins and aunties who are that's just like, and that's just me, like coming from my line. I'd be surprised if anyone, if you're a white person listening to this podcast, there's 99% chance you've run into a Black person in the healthcare system. And they're doing an amazing job. Myself as well, I would say my sort of reclaiming the narrative is to encourage people to give blood, and especially when we talk about sickle cell and all these things, we really need to like keep diving deeper into the research surrounding our people. And like I've definitely made a conscious effort, like probably like since COVID, to try and give blood at least once or twice a year. Actually strangely enjoy it in a weird way, but I don't know why that is.
Separate podcast for that one. Yeah.
It's a little bit therapeutic. It's actually maybe I've gotten too used to it, but anyway. But yeah, it's generally. But then when you like speak to the nurses and like you actually understand the impact that it has afterwards, then yeah, it's definitely something that I'll like as long as I'm healthy enough to do so, I'll definitely try and do for our people, because it's especially sickle cell as a key point. I think it's one that can definitely help to resolve that. So yeah.
Can I add a quick one?
Yeah, please
Sorry,
do. Yeah.
I think linked to your giving blood, I think it's for us to also encourage our community to get on the donor form, on the donor register. Again, there's a lot of stigma in our community around donating your organs, but when you're the recipient, that's when you truly appreciate that it's okay. They wouldn't take your lungs if you are still breathing, or they wouldn't take any part of your body.
The stigma attached to that is
So we just need to normalize us adding ourselves to the donor register. Thank you.
Thank you for sharing, Yomi. And thank you guys once again for your words, for your time. Thank you everyone who's listened and tuned into this podcast. It's been another really poignant discussion, and really like raised so many good points to take away and to even have further discussion about. So I'd encourage everyone listening to please like write in the comments your thoughts on these discussions and the various different topics. Ask any questions if there's anything that stood out. You think, oh, like I'd like to know more about this, then please ask away. Whether that's on the YouTube or the workplace, wherever you're you're listening to this podcast. Yeah, keep tuning in to the various different Tackling Taboos podcasts that we do. Suggest as well if there's any topics that we haven't covered yet that you think would be worth doing a podcast about. Like, we're always open to ideas and suggestions. But yeah, just to thank you once again for everyone's time, and yeah, we will see you again on the next one. Take care. Bye bye.
Thank you all.
Right.
Thank you.